in 2018, we invited Dr. Mohan to visit Hebei Medical University Hospital for also for the plasma event. It's on-site event. And I have a photo. I have the photo, and when Dr. Mohan is with is in Hebei.
OK，
就是他在18年，当时我们在河北医科大学的等离子培训中心，授牌建立的。当时，
单主任那边那边。
OK，
就当时邀请。
It was a cadaver, temporal bone cadaver dissection, endoscopic cadaver dissection.
OK. So, Dr. Mohan, did you made it go to Japan this year? This World
because
conference.
In conference in the Kyoto.
Yes. Did you made it go?
No, this year I didn't go.
Yeah.
Last 3 congress, I was there for 3 conferences.
Okay.
Boston was the last one. Boston, USA.
Okay.
This time I could not go because of this COVID and so many problems of visa to Japan.
Yeah, me too. Yeah.
I've been to Beijing in the People's Hospital.
Hello.
Yeah.
Hi, Dr.
I've been to Beijing. Yes.
Can I
Please
speak?
go on.
Yes.
Yes.
So I want to first congratulate you for the beautiful demonstration, especially the facial nerve decompression and the stapes which went into the vestibule. Those cases were beautiful. And I want to ask you, like, once you remove the stapes, what happened to the patient regarding the vertigo and the sensory neural hearing loss?
You mean after operation?
Yes, that stapes got fractured and went into vestibule, right? Which you removed.
After operation, this patient didn't have any experience of vertigo, and after put the patient to reconstruct the hearing function, this guy had a normal hearing function.
No sensory neural loss at all.
No.
Oh, that's great. Did you give steroid or something to prevent that? And how fast you operated, like from the trauma causing the fracture to your surgery? What was the time frame?
3 months.
After 3 months?
Yes.
Okay.
After the traumatic fracture, he got 3 months frequently vertigo and consistent hearing loss. So there's no way to resolve the problem. He come to me and I made an operation on him. After the operation, the hearing function go back to normal and the vertigo has gone. Yeah.
That's amazing. This is something very new, which I saw, that traumatic fracture which has been repaired and the hearing is absolutely normal. And the facial nerve decompression case was also beautifully performed. Like when we got this, want to try, the main thing which I didn't understand, that how to use this continuous irrigation. Today, your presentation made that very clear, that without continuous irrigation, it doesn't help. All the trick and the technology depends on this continuous irrigation thing.
So you mean when we made the operation under the continuous irrigating system, did it made any potential cause to the inner ear? Is that the point, right?
No, first the point is that this continuous irrigation thing made it look much easier and smooth when you showed that, which I was not so sure about how to make use of this technology. Now, after seeing this, we can go forward to give it a try again. On the first very few trial, we didn't make use of it. For that, I want to thank you to show us that how to make use of the continuous irrigation.
Okay, thank you.
Yeah, and the second question is that when you are working underwater and using the coblation technology, is there any chance of inner ear damage?
Inner damage? So without if without any previous experience, I cannot use the continuous irrigating during this kind of operation, because we have no idea if that can make any cause to make any hurt or trauma to the inner ear. But we do some semicircular canal fistula. We will drill out some cholestoma of the inner membrane of the semicircular canal. We can see the intact of the membrane really nice, so that make our confident to do this kind of the operation like this, the inner ear. There's no damage to the inner ear. Just in terms of the water fusion or irrigating, there's no damage to the inner ear.
Okay, got it.
就侯主任他，感谢侯主任，他是2个问题。第一个，他说他之前试过，但是他达不到就是您手术视频里面显示出来的那么流畅、顺畅、清晰的这种持续灌流的这种效果。他第一个问题是说，就是这是怎么做到的？他可以，可能他后面的手术里面，他可以再尝试一下你的方法。
Okay. So if you just have a really nice experience to perform the operation under the continuous irrigating, maybe I think maybe there is something wrong with the system, or you cannot make it right. I think when you did some a couple of the case in the next future, you will gain more and more experience. Make your operation easier and easier. I think so.
Correct. It looks like when I saw, it was something like arthroscopic surgeon, how they operate in the joint space, something like that. We are going to adopt in ENT.
Yes.
Anyhow, this is a new technology. I think we have to welcome Bonds coming out with a wonderful technology application into the endoscopic ear surgery. We hope that they will get more and more improvisations and make our job easy in future.
Yes, I think so.
Yeah, it's a beginning, and I think they will add some more good features and overcome the problems.
Yes, it's really a good start, good beginning.
Yes. Yeah, that's good. In future, we need multiple applications, multifunctional tools.
Yes.
Very important. I think if we can add a suction to the instrument, either to the probe or to the irrigation channel, there also you can have a suction. If there's excess water flowing, excess saline, we can suck it simultaneously. And there is a kind of a spark, like I think whenever we press the coagulator in plasma, foot control, foot switch, there'll be a spark. Sometimes it is blurred. Sometimes all those things probably we will overcome in the future. But some wonderful probes they have designed. The design of the probes are really wonderful. Simultaneously, it has got a knife and also the plasma application for controlling bleeding. That's wonderful.
Dr. How
about incorporating the? How about having the irrigation and the suction into the probe? Plasma probe.
So Dr. Mahan,
did you, into the probe, can we incorporate a suction and irrigation? Because the irrigation